Okay. Okay. Good evening, everyone. Welcome to the second in our series of the Patient Education Programme, hosted by Hashir International, Specialist Clinics and Research Institute for Misophonia, Tinnitus and Hyperacusis. Hashir International is a multidisciplinary organisation which aims to help you with assessment and management of your misophonia, tinnitus or hyperacusis. Each month, we'll be exploring a different topic within sound sensitivity, aiming to give you a broader knowledge and understanding of these conditions. My name is Joanna Barker, and I'm your host for these sessions. I have been an audiologist for the last 12 years, and I'm a specialist in misophonia, tinnitus, and hyperacusis. Sound sensitivities are my passion, and I'm really excited to bring these live sessions to you. Today, we are kindly joined by India Lawton, a postgraduate research student in practice-based fine art photography. India has a Master's in Education from Oxford Brookes University, a PGCE in Post-Compulsory Education at Oxford Brookes University, a Master's in Photographic Studies at the University of Westminster, and a BA Honours degree in Photography at the Arts University College, Bournemouth. And she has hyperacusis herself. India is sharing with us a presentation on echoes of birth, exploring the intersection of birth trauma and hyperacusis through artistic expression. In this talk, India will be discussing birth trauma and the numerous identified risk factors for birth trauma and PTSD, including the impact of specific auditory conditions such as hyperacusis. India has created artwork which investigates the multifaceted impact of birth trauma, with a particular focus on the intersection of hyperacusis. As an artist, researcher, and mother suffering from hyperacusis with a history of birth trauma, she initiated an art project to articulate and share the experience of childbirth and hospitalisation as someone with hyperacusis. There will be the opportunity to ask questions after the presentation, so please feel free to post these through the chat function. Thank you so much, India, for joining us. I will now hand over to you.
Thank you very much. And thank you for the introduction and inviting me today. I'm just going to share my screen. So if I go on this, and then I go on presenter view,
That's
hopefully you can
perfect.
see everything there. I'm just going to close that down a bit as well. So thank you very much for joining me this evening. I'm really pleased to be here and to share my research, artworks and personal experiences as an artist living with hyperacusis and navigating the complexities of birth trauma. Just a heads up, I am dyslexic and sometimes I do stumble over my words a little bit and make up words. And I'm also recovering from a cold, so if I start coughing, I'm so sorry. I might mute myself for a minute so you don't have to hear it. So today, to begin with, I'll provide some background on what birth trauma actually is and what hyperacusis is, although I'm sure most people who are watching this will know. I'll also explore potential links between the two. I just want to clarify now that I'm not an audiology expert or a hearing specialist. My insights are based on my own research as I seek to understand my experiences. I'll also highlight examples of how other artists have used their work as a means of managing trauma, along with my own creations. I hope to convey what my work communicates and how the process of creating it has supported my journey towards recovery. So first of all, what is hyperacusis? Hyperacusis is an abnormal sensitivity to everyday sounds, making them seem excessively loud or painful. It affects approximately 9% of the population, although the true prevalence may be higher due to undiagnosed cases. While often there's a link to hearing loss or neurological conditions, many cases just lack a clear cause. Hyperacusis has different subtypes, including pain hyperacusis, which causes physical discomfort, and fear hyperacusis, which triggers anxiety. These can worsen emotional distress and impact daily life. Stress, especially in high stress situations like surgery, can heighten hyperacusis, and prolonged exposure to stress hormones is linked to its development. Although treatments like sound therapy and CBT, cognitive behavioral therapy, aim to improve sound tolerance and manage emotional responses, their effectiveness in high stress situations such as childbirth, as far as I can see, remains unclear. So, birth trauma. Birth trauma refers to trauma symptoms experienced during childbirth. It's a very complex thing. It can affect not just the mothers, but also partners, medical staff, and anybody else involved in the birth. Around 1 in 25 women experience PTSD after childbirth, and 24% report some aspect of their birth traumatic, with an estimated 200,000 women in the UK suffering from unaddressed birth trauma annually. There are many factors that can contribute to birth trauma. It can include depression during pregnancy, fear of childbirth, emergency procedures, feelings of disempowerment, and much more. Trauma symptoms can include disappointment, anger, guilt, depression, flashbacks, difficulties bonding with the child, and others, which are all unique to each sufferer. Stigma surrounding birth trauma often leaves women feeling isolated, guilty, and reluctant to seek help. This silence can strain relationships and affect emotional intimacy. Experts suggest that improving maternal care and increasing emotional support during labour can help reduce traumatic birth experiences and prevent long-term effects on mothers and infants. So, from what I have found, the relationship between hyperacusis and birth trauma remains largely unexplored. The multiple activity scale for hyperacusis and similar scales for rating hyperacusis seem to evaluate the impact of it in everyday life, but fall short in capturing the complexities of high stress situations like childbirth that, of course, don't happen every day. So, birth trauma can arise from various factors, including physical interventions and feelings of disempowerment. Research on hyperacusis during childbirth is limited. While studies on birth trauma often highlight feelings of disempowerment, they rarely consider sensory sensitivities. This oversight is concerning as healthcare professionals may fail to recognise or accommodate conditions like hyperacusis, which could increase the likelihood of trauma. Even normal births can result in trauma if emotional or physical vulnerabilities are overlooked. PTSD is also frequently associated with heightened sound sensitivity and can manifest as hyperacusis. Sounds linked to past trauma can elicit intense emotional responses, including fear and flashbacks. In childbirth, the overwhelming sounds of a hospital environment may worsen these responses for women with existing hyperacusis. Gender and emotional exhaustion has also been linked to hyperacusis. It's been found that women experiencing emotional exhaustion are more sensitive to sound after acute stress. This suggests that managing stress and an awareness of hyperacusis during childbirth could be key to minimizing trauma for those with it. So, a little bit about kind of me now. Reflecting on my life, I now recognise that hyperacusis was a constant yet initially undiagnosed presence. So, as a child, I instinctively sought quieter environments, retreating to the car during fireworks and struggling to focus in school due to background noise. Events like school discos, as much as I love them, often left me sleepless, tormented by the ringing in my ears. And even at the cinema, whispering and food packaging noises distract me, and I can't concentrate on the film anymore. Daily life was exhausting. The bus commute, filled with the clamour of conversations and traffic, drained me before my day even began. Microphone feedback at events triggered dizziness and fear, prompting me to avoid some social situations and wear earplugs in public. Simple tasks such as asking someone to repeat themselves after being distracted by ambient noise became frustrating, and I often lost my train of thought whilst I was teaching, which was embarrassing. In 2020, while struggling to focus in a noisy open plan office and a distressing episode in a waiting room where just the sound of somebody flipping through a magazine brought me to tears, led to my referral to a specialist, and I was diagnosed with hyperacusis. I felt immense release in finally having a name to my experience and feeling heard. I began to reframe my condition, sometimes viewing it as my superpower. It meant I could hear whispering in class and what the students were saying. Yet I still struggled with the annoyance in public spaces, and I often felt that people were there to intentionally irritate me with loud conversations or music from their phones. Cognitive behavioural therapy, the CBT, encouraged me to reflect on these social settings and question the motivations behind noises. This reframing helped me to find peace in previously distressing environments, lessening my sense of being targeted by the world. In January 2020, the first case of COVID-19 was confirmed in the UK, and by March, a national lockdown was implemented. This disrupted my CBT progress, limiting my exposure to real world challenges. During this time, I also became pregnant, and I experienced a quiet, low risk pregnancy, but I was unable to attend support groups due to lockdown restrictions, relying on online resources for information, as many did at the time. In March 2021, I underwent an emergency C-section after a 3-day hospital stay for an induction at 41 weeks. This was followed by nearly 24 hours of waiting to be transferred to a labour ward after my waters broke. Post-birth, both my baby and I required further hospitalisation due to infection, and this was all during the heightened pressures of the COVID-19 pandemic. The pandemic had already transformed healthcare services globally, amplifying anxiety for mothers and newborns, and leading to increased levels of postpartum anxiety and depression. Birth trauma is often tied to negative experiences such as emergency procedures, prior trauma, lack of support, and unmet expectations. In my case, while hyperacusis was not the sole cause of my birth trauma, and many of those other factors were, it did play a significant role both during childbirth and in the postpartum period. So during my pregnancy, I mentioned my hyperacusis at antenatal visits, but the midwives were unfamiliar with the condition. This lack of awareness around hyperacusis in pregnancy and childbirth became clear early on. It left me feeling that either the hyperacusis wasn't going to pose any problems or that no one knew how to support me, which made me feel very isolated. During the 3 days of induction on a shared ward, unable to have visitors, I was attached to a baby heart rate monitor equipment. The beeping of the machine was a constant reminder of the potential dangers, and the sound environment grew overwhelming, with 6 other women around, their labours progressing at different paces. One night I lay awake as one woman moaned in pain while another cried on the phone, worrying she'd miss her chance for an epidural. These distressing sounds compounded my existing fear about birth, layering with the hum of masked conversations, clanging equipment, and the steady movement of staff across the ward. After my waters broke, I waited almost 24 hours for a bed in the labour ward due to overcrowding. Although I was eventually moved to a private room, the relentless noise remained a source of stress. After a long labour that failed to progress, I was sent for an emergency C-section. Once transferred to the operating theatre, the sensory overload peaked. I was surrounded by medical staff. I was bombarded by overlapping conversations. Some were directed at me, others aimed at my partner or the surgical team. At one point, I heard a surgeon call for help, heightening my anxiety amidst the echoing voices. Heavily medicated, and I had intense shakes and shoulder pain from the procedure, further intensified my distress. Amongst this chaos, my baby's first cry cut through the noise, and I struggled to process that this sound belonged to my daughter, unprepared for the intensity of this new auditory experience. This was not how I imagined I would feel during the welcoming of my daughter into the world. Following my C-section, my partner had to leave, and I was moved to a shared postnatal ward with my newborn. Emotionally raw and physically exhausted after 2 sleepless days, I felt overwhelmed by the noise of 3 crying babies, a distressed mother struggling with breastfeeding, and another on the phone to family at all hours, and a constant beeping of medical machines. This disharmony was unbearable, and I found myself crying behind the curtain of my hospital bed, unable to cope. It was during this moment of vulnerability that a healthcare worker finally asked about my hyperacusis. To my dismay, no mention of the condition had been passed along from my GP or my midwife. Despite having managed my hyperacusis well after completing CBT therapy, I hadn't spoken up about it during my hospital stay. They suggested earplugs, and I refused, fearing I would miss crucial sounds from my baby and aware that they didn't really help and that earplugs could worsen hyperacusis. While there were many factors behind my birth trauma, hyperacusis amplified my fear and my anxiety, making an already challenging experience feel unbearable. The lack of awareness amongst healthcare professionals, combined with the overwhelming hospital environment, left me feeling unsupported and vulnerable, heightening the trauma of my childbirth experience. Once home, it took me 18 months to realise that what I was suffering from was birth trauma and to speak to anyone about my struggles. The stigma surrounding postpartum difficulties obviously often prevents mothers from seeking support, especially when the birth of a healthy baby is widely seen as a joyful event. This can lead to feelings of isolation, guilt, depression, as women may feel weaker than others. Hogan describes how the dismissal of birth trauma by those around us has created a culture of suffering in silence, which can have profound effects on women and their relationships. My hyperacusis intensified during the postpartum period, undoing much of the progress I'd made through CBT. Before therapy, I'd avoided some social settings for fear of being overwhelmed by sound, and the heightened emotional exhaustion of caring for a newborn caused a regression. Research shows that women with high levels of emotional exhaustion often experience an intensification of hyperacusis symptoms. Simple household noises became unbearable. Baby rattles, musical mobiles, and the cries of my baby before feeding time created a chaotic auditory environment. Even the constant churning of the washing machine, cleaning muslins and soiled baby clothes became a source of stress. The combination of physical pain from breastfeeding and recovering from my C-section only compounded the sensory overload. Even at night, the frustration of unsuccessful latches during mid-flight breastfeeding sessions amplified my normally unnoticeable tinnitus. The quietness of the night, punctuated by external sounds like distant cars or creaking floorboards, triggered memories of my traumatic birth, reinforcing my disconnection and deepening my sense of isolation. So, I've got a few examples to share with you now, kind of before I show mine, to show what's kind of inspired, I suppose, my own practice. The arts offer a powerful means to understanding pain and trauma by providing non-verbal outlets for pain sufferers and trauma survivors to express emotions beyond the limits of language. Through visual art, music, and storytelling, individuals can symbolically process their experiences, promoting personal healing and fostering empathy. Art also allows people to regain control by reshaping their narratives and making sense of fragmented memories. This approach is often used in participatory research, where researchers and participants co-produce knowledge using arts-based methods to explore emotional expression and storytelling. While challenges like misinterpretation and vulnerability exist, careful ethical considerations empower participants and foster community through shared creative experiences. This example here is from the Face-to-Face project, led by artist Deborah Padfield, also working with a specialist in facial pain and patients who suffer from chronic facial pain themselves. The project utilised co-created photography to capture the complexity of pain, which traditional pain scales often fail to convey. How do you explain a feeling? There's only so much that words can communicate. This process empowered participants to visualize their pain and reclaim their narratives, fostering a therapeutic dialogue between patients and clinicians. The Birth Project in 2015, led by Susan Hogan, was a participatory art initiative inviting new mothers and others involved in the birth experience to explore their journeys through art. Art therapy workshops facilitated discussions and creative expression, addressing birth trauma and postpartum feelings. Participants frequently reported isolation and trauma, often dismissed by healthcare providers. They incorporated everyday mothering items into their artwork, connecting with personal experiences and exploring sensory dimensions. Overall, the project validated unspoken emotions and provided therapeutic support, demonstrating how art can transform and affirm birth experiences, offering relief to those coping with trauma. So, the two examples I've shown you are people who are not artists and how they have used arts to help them with coming to terms with their pain and trauma. Many artists have focused on the complex experience of motherhood in their practice. So, one such artist is Louise Bourgeois, who explores trauma and memory through sensory and material based approaches in her art, focusing on motherhood, vulnerability, and emotional depth. Her work reflected both universal and deeply personal themes, often referencing painful childhood memories tied to her complex relationship with her mother. After becoming a mother herself, she experienced gratitude alongside feelings of inadequacy, repeatedly reliving childbirth in her art, particularly in later years. One notable representation features a mother with an umbilical cord still attached to her baby, symbolising the enduring connections and complexities of maternal experience. There are very few artists who specifically focus on birth trauma, and even less who focus on hyperacusis, but many have used their creative practice to process and rethink trauma and pain. Two I'd like to introduce you to are Frida Kahlo and Jo Spence, who's on this slide here. Their work offers a powerful resource for understanding the dehumanizing effects of pain. By documenting traumatic experiences visually, these artists allow viewers to empathize with their suffering, providing a broader understanding of the patient's experience and offering a means for reclaiming agency. Jo Spence was an artist who used photography to reclaim agency over the representation of her illness and her body. In the late 1970s, she employed something called phototherapy to explore her experiences, allowing her to reframe past images and reconstruct memories, which she believed could lead to healing. She was diagnosed with breast cancer in the early 80s, and she felt powerless as though her body was managed by medical professionals. Through phototherapy, she documented her hospital experience, regaining control of her narrative. Her work provides crucial insights into the patient experience, highlighting important issues for the medical profession. Frida Kahlo, a Mexican artist, explored her life, pain, and disability through her art, interweaving the mind and body to depict the female experience and the impact of chronic pain on her existence. Enduring polio in childhood, a near-fatal bus accident, and lifelong reproductive issues, Kahlo focused on painting during her recovery, using self-portraits to visualise her pain. Her poignant work, Henry Ford Hospital, 1932, which we can see here, illustrates the grief of a miscarriage, emphasising the loss of a child rather than the birth. Kahlo's portrayal of physical and emotional suffering offers viewers insights into her experience, with her paintbrush likened to a walking stick, an extension of her body. Storytelling and creating alternative forms of representation resonates with my image making practice. Through various projects, I've employed visual methods to explore personal experience. As Padfield notes, visual representations of pain and illness exist outside the body, yet evoke personal testimony, allowing these experiences to be acknowledged and symbolically held. Such works act as an abstract self-portrait, functioning as a form of expressive therapy. After being diagnosed with hyperacusis, I turned to photography and photo montage to process the overwhelming sensory experience accompanying it. This led to Soundscapes of Sensitivity, Layers of Hyperacusis. There's an example from that series here, which visually captured the claustrophobic sensation of being overwhelmed by everyday sounds. The photo montages depicted how layers of noise enveloped me, creating a sense of entrapment that mirrored my internal experience. For trauma survivors like myself, visual arts facilitates dialogue and anchors meanings in ways that verbal expression may struggle to achieve. The images I create allow me to transform traumatic experiences into something interpretable and shareable, providing control over how trauma is presented. This act of visual creation enables me to re examine my narrative and regain autonomy over my personal story. Examples of my broader practice can be found on my website, but today I want to talk to you about my work exploring birth trauma and hyperacusis. Following my birth trauma, intensified by hyperacusis, I returned to photography to make sense of the profound physical and emotional impact of that time. The project Echoes of Birth, a Tapestry of Milk and Memory, vividly recalls a night on a postnatal ward where I was behind the hospital curtain, overwhelmed by sounds, babies crying, medical equipment beeping, and footsteps on the hard floor. These sounds were not mere background noises, but overwhelming forces that engulfed my body, adding stress to an already intense experience. Reviewing my birth notes revealed many references to the negative effect that sound had on me, but these records could not convey my kind of actual experience. To visualize this, I photographed the hospital environment and my birth notes, and I later immersed these images, which were on 35mm film, in breast milk. So this is a technique called film soup, which involves soaking undeveloped film negatives in liquid to alter them, and it kind of eats away and changes the photographs. The breast milk symbolised the intimate connection between my body and the experience. The resulting images blurred and altered by the milk, reflected how my personal reality had been subsumed by layers of sound and sensation. I printed these altered images onto fabric and transformed them into small quilts. So quilts are traditionally symbols of women's work and associated with warmth and protection and significant life events such as birth and death. And this starkly contrasts the fear and vulnerability that I experienced. So, by layering fragmented images, I sought to visually represent the overwhelming layers of sound that haunted me during childbirth. The images made with breast milk treated film also serve as a contemporary feminist commentary on the intersection of birth, body, and trauma, challenging sanitized depictions of childbirth that we so often see. To deepen the sensory exploration, I created an audio track, which I'll play in a second, just a little bit, composed of the sounds that affected me on the ward. And then I made these sounds into a sound wave and embroidered this sound wave onto one of the quilts. The rough stitches and the visible punctures in the fabric mirrored the physical and emotional punctures that I experienced, the sounds that pierced my senses and the pain I endured during recovery. This combination of visual and tactile elements allowed me to externalize my trauma and confront it through a creative process, layering vulnerability, sensation, and memory. I'll just play the original soundtrack for a second. It's not very nice. So another piece that I created is called Midnight Echoes, Silent Sound and Solitude. In this, I delve into my postpartum experience, focusing on the quiet midnight hours of breastfeeding, where hyperacusis intensified the nighttime sounds around me. Fatigue accompanying nighttime breastfeeding, often worsening hyperacusis and tinnitus, heightened sensitivity to sounds that would otherwise go unnoticed. It created an overwhelming sensory experience as I navigated feeding my daughter. The interplay between birth trauma and breastfeeding can shape the emotional experience of motherhood in divergent ways, as Beck and Watson discuss. For some women, breastfeeding becomes a source of strength, while for others, it triggers flashbacks of trauma endured during childbirth. For me, while some breastfeeding was a moment of connection and peace, Other times, unsuccessful latches during midnight sessions, coupled with fatigue and the weight of my birth trauma, made breastfeeding at night a particularly fraught experience. Mundane sounds took on new dimensions, acting as reminders of the hospital and moments of vulnerability. So the piece is meant to be an installation piece, and it's a video. The video created for this piece visually and sonically captures these moments of solitude, immersing the audience through its installation format. A breast milk film soup moon, so the moon is projected into a darkened room and is the sole light source, invoking the quiet, isolated atmosphere of late night breastfeeding. The moon motif reflects this nighttime setting and my deep sense of isolation. An audio track of nighttime sounds combined with the persistent tinnitus accompanying my hyperacusis fills the room, grounding the piece in my sensory experience. This central auditory element embodies a tension between nurturing and resurfacing trauma. The moon's surface is made out of a cropped photograph of medical notes, which has been textured by breast milk film soup, and it embeds my physical experience into the work, blending the organic reality of motherhood with experimental image making. As the piece unfolds, the moon image enlarges while the video audio increases, enveloping the viewer in a crescendo of sensory experience. This installation invites the audience to engage with the sensory overload I faced, where sounds and silence intertwine to evoke the complexities of vulnerability, isolation, and maternal healing. I'll just play a short clip of the sound for you now. Oh, yeah. Well, I seem to have lost that. So creating art empowers me to transform my traumatic experiences into interpretable and shareable narratives, allowing me to reclaim autonomy over my story. Through visualizing my journey with hyperacusis, I communicate the nuances of my condition in a natural and intuitive manner for me. This fostering an understanding and control. Art making has also facilitated connections with others. So I performed a piece called The Little Yellow Hat, which was a spoken word performance in an unfamiliar country, and it was transformative. Despite being really anxious about doing it, I felt a deep intimacy with the audience, sharing a collective experience that transcended my trauma and engaging in rewarding exchanges post-performance. Being part of the organising committee for the Sound Off competition also enabled me to engage deeply with deeply personal reflections from participants who shared their artwork alongside their experience with conditions like misophonia, hyperacusis, and tinnitus. It's creating the artwork has also enabled me to tap into community, which has been really important. My artistic practice serves as a tool for reclaiming my narrative through visual storytelling and fostering empathy for others with similar experiences. By integrating various mediums, I emphasize the visceral nature of trauma, facilitating shared understanding of its impact on motherhood. The interplay of sound, fabric, and visual representation articulates the complexities of my experiences, highlighting the significance of self-representation and the healing potential of art. Ultimately, my work underscores the profound relationship between trauma, memory, and sensory experience. Through each project, I explored the intimate connection between the body and the narrative it embodies. By transforming personal experience into visual language, I encourage dialogue around trauma and motherhood, paving the way for collective healing and understanding while inviting viewers to engage with their own experiences and fostering a supportive community. And finally, in my opinion, individuals with sensory sensitivities, particularly hyperacusis, face significant challenges during labour due to overwhelming sounds that can increase anxiety and contribute to birth-related trauma. While significant changes in medical environments may not be feasible, small adjustments like creating quieter spaces and minimising noise can greatly improve patient experiences. Effective communication between healthcare professionals and patients is crucial, as time constraints often prevent patients from expressing their sensory needs, which can be overlooked during shift changes. Current assessment tools for hyperacusis do not appear to address the unique stresses of childbirth. Increased awareness of hyperacusis can foster more empathetic care, leading to meaningful changes in communication and environments that enhance the birthing experience and mitigate trauma for those with sensory sensitivities. Additionally, more tools and discussion about these experiences can help prepare individuals for these type of life-changing events. So thank you so much for joining me today, and thank you so much for inviting me as well. I will now stop sharing my screen, like
Thank
so.
you. India, that was amazing. That was such an enlightening experience. I really appreciate you sharing that with us because obviously, it's not always, even though you've processed this birth trauma, it's not always easy to continue to relive it. But I found that absolutely fascinating. Thank you so
Thank you.
much. It actually made me think of you had some really incredible points about how the healthcare system manages patients with sound sensitivity. And I recently had a patient who had to attend A&E and has hyperacusis and misophonia. Um, and left A&E in the end because the sensory experience was far too overwhelming. And so that's, really difficult. And it's something that we have been trying to explore and seeing whether there is something that we can do to support these patients in a different way. Obviously, with birth, you can't leave, you have to
Yeah,
stay.
but it's the same
Um,
with A&E. That probably wasn't, that was quite out the norm, I imagine.
Yeah, yeah. And it's, but like you said, bringing this awareness is really important so that healthcare workers can understand a little bit more about the conditions and how they can support patients who, are having these issues. So, thank you so much for that. I really appreciate it. Um, I do have some questions for you, if that's okay.
Yeah, of course.
So the first question is, some people analyze artists' work and conclude that they might have had a certain medical condition. For example, Vincent van Gogh is thought to have had Meniere's disease, which is characterized by patients who have tinnitus, hyperacusis, dizziness, and hearing loss. Do you know how they do such analysis, and have you heard of any examples relating to hearing problems?
No, I haven't. I think, the thing is that in hindsight we can look at people's artwork and try and draw think conclusions from it. I think a lot of the time the artwork is created in the way that it's meant to speak to a broader range of people, people who maybe haven't got exactly the same condition but are experiencing similar emotions. Um, but in terms of kind of more recent artwork, I've apart from kind of lesser known artists, I've not encountered any with who have spoken about a hyperacusis, misophonia, tinnitus. And if anybody does know any, I would appreciate them reaching out and letting me
Yeah.
know. Um,
Do you think that that might happen later on? So obviously now where we're living in a generation where we're much more aware of neurodiversity, and so people can sometimes feel like they can relate to artists and artwork because they, feel like maybe that person was autistic or they had ADHD characteristics. As you sort of said before, there was a lot of healthcare workers that you met that didn't understand what hyperacusis was and misophonia. And so that knowledge is, part of the reason why we're doing this patient education program is to bring awareness to these sound sensitivities. So do you think maybe later on down the line, when, hopefully people are more educated around sound sensitivities, that might be more evident?
yeah, I hope so. I mean, I think whatever role you're in, if you're working with other people, um, empathy is a huge thing, and we might not necessarily understand completely what somebody else is going through. But I think to be truly inclusive, it's to, I suppose, try to recognize when somebody needs support and asking them what it is that they need. I mean, I imagine there are so many different barriers that people might face when they're in these situations, whether it be surgery or birthing or anything. Um, that it's very hard for healthcare professionals to know everything, but
Yeah.
kind of that communication of between kind of GPs and passing on information or giving that little bit of space for a patient to say. I mean, for me, a lot of the time, I could see they were so busy that I just didn't want to be a bother, and I didn't want to tell anybody about this or that because I thought, oh, they're so busy, I'll just leave them to it. So I suppose, yeah, that kind of having empathy and a little bit of time to just check in can make a big difference as well.
Hugely, isn't it? They might not have, we might not have the resources and the ability to resolve the issues that you're currently experiencing, but a sympathetic ear and somebody who's actually listening to you just goes that so much further.
Yeah.
Um, the next question is, some say that Picasso's cubism work was due to his strabismus, so abnormal alignment of the eyes,
Mhm.
which has affected his sense of perception of depth. This is thought to have helped him to create two-dimensional work from three-dimensional objects easier than others because he couldn't perceive the three dimensions anyway.
Mhm.
What do you think about that? Do you feel that that's impacted? So these other conditions that artists are experiencing are sort of coming out in their work.
Yeah, potentially. I mean, it can also be, for artists, it's about seeing the world in a new way and about trying to explore those other sides, taking something 2D and how can I present it as 3D, whether that's linked to a condition or not, I'm not sure. But again, I said during my presentation, sometimes I think of my hyperacusis as a superpower rather than something that is it can cause me lots of issues, but equally, if I'm out in nature and I sit there, I can hear so many layers of sound, and I find that maybe my experience of things is different than somebody else, and that isn't necessarily a bad thing. And it might be that artists are using their superpowers in ways as well to explore the world and present the world in a new way, whether that be through music or visual arts. But yeah, so I didn't it show I didn't know that condition that you just said then. So
No.
learning all the time.
It is, isn't it? And so the other question is regarding synesthesia,
Mhm.
and how that might have influenced people's art. Synesthesia is a neurological disorder where activation of one sensory area instantly activates another sensory. So when people see colors and they hear music and so on,
Yeah.
what do you think about that?
Yeah, again, I've seen there's a few artists who have done work with that before. Their name has escaped me. But yeah, again, it's seeing the world in a different way. And I think that, just going back to kind of Padfield's work, working with people who have got chronic pain, how do you express to somebody what you're feeling and what you're seeing? We can do it through words, we can do it through writing, but there's something about kind of creating something visual, something people can look at or be involved in that means we can read it on another level. We are involved here and we are involved here. And I think that that's really, it's being able to share visually in other formats just gives another way to interpret and to communicate as well.
Yeah. And again, it's bringing that insight, isn't it, into all of these different conditions that aren't so well known.
Mm.
On a slightly lighter question, I wanted to ask you if you had any advice that you would give to expectant mothers who have sound sensitivity and are worried about giving birth.
I think for me now it would be not to feel like I'm being a bother and to let people know because not relying on things having been passed over,
Yeah.
because information hadn't been passed on. And actually, when I did let midwives know, rather than me sitting there suffering in silence, they were great, and they tried desperately to see if they could get me a room to myself. I did have to wait a few days, but I was able to. And if I hadn't have spoken up, then I would have still been crying behind that curtain.
Yeah.
I think also it's that maybe making yourself aware beforehand of what sounds you might encounter, because there was a lot I didn't anticipate I was going to hear. So, for example, my daughter's first cry, I hadn't even thought about that. And for me, sound is so important. And when I first heard it, I was so confused. I thought, what's this? Who's this in the room? There was suddenly another person there. So, yeah, trying to pre-plan what noises you might encounter, I think that can help with preparing as well.
That's possibly something that you've learned through CBT as well, because that's what sort of I sometimes do with my patients is go, right, okay, is there a situation where you are feeling anxious? Let's preempt that. Let's analyze that situation and maybe sort of go, right, okay, pick it apart and challenge those thoughts that you're having
Mhm.
around that situation. So I think that's a really good bit of advice to sort of almost pre-plan. And then, like you said, that takes away that shock factor, doesn't it? And eliminates some of that fear, hopefully.
Yeah, I think it's because for me, my hyperacusis a lot of the time was because I became very irritated by noise. So I didn't expect to then suddenly it to transform into fear and other emotions that I hadn't associated with it before. So yeah, it's just being open to things changing, and like you said, preparing for different situations.
I suppose that's just in general with giving birth, isn't it? Is that having
Mm,
that openness that, we have this birth plan and
yeah.
it never goes to plan. So actually factoring in your sound sensitivity and looking at all the options can just help hopefully to relieve some of that anxiety.
Yeah.
Um, I have two more questions, if that's okay with you.
Yeah, that's fine with me.
Um, this is a slightly interesting question. What your opinion is on this? Can an unborn baby develop hyperacusis if mothers experience stress due to noise? So the baby can feel the stress due to hormones and hear the noise, as the hearing system is the first sense that the fetus develops. So
Mm,
can stress and noise create a connection and a conditioned response, do you think?
I have no idea from a kind of medical perspective, but I can definitely see how that could be. If for me, having hyperacusis, particular noises can be more distressing, and if when that's happening, the hormones are being released, and babies can hear, through what's going on in the outside world. I wouldn't be surprised if there wasn't something that when baby arrives, they're already preconditioned to particular noises to cause them stress in some way. So yeah, I'm afraid I don't have any medical knowledge on this, but yeah, I can see that could possibly be something that could really happen.
And your daughter hasn't had any issues with sounds.
Well, yeah, I'm not sure. Again, I'm not 100% sure. She's 3.5, and she's recently started. There's sounds which before didn't bother her that do. And I don't know if that she's now got a fear of things she didn't previously, but she is wanting to put her hands over her ears quite a lot. So maybe that sometimes they are noises that I also similarly feel kind of anxious about. Maybe it's that she can see the reaction in me, or maybe it's from when she was in my tummy. I'm not sure. Or maybe it's just unique to her.
I think around that age, I think sound sensitivity, noise sensitivity does tend to develop. We see lots of sort of children within pediatrics, and obviously some of them they grow out of it,
Mm,
and some of it can manifest into other situations. But obviously, having a mother who's so aware of these things is going to be such a help to her in that situation. So,
yeah.
like you said,
Hopefully, if I can support if needed.
it's building back up on that superpower, isn't it?
Yes.
So that's amazing. My last question, I hope you don't, this isn't too personal, but it's just to say, how do you feel like you're managing your hyperacusis now?
Much better. I think also being a mother, I've learned to let certain things slide a bit more and not quite so tense. So I think I've become better with the issues before my daughter was born and kind of gone back to my CBT um, kind of the things I learned from that. So I do feel much better with it. Um, I suppose it's also now that it's 3.5 years on, and I've come to terms with a lot of things, and again has also maybe lowered that stress that I was feeling all of the time, which again I think has maybe helped with it too. There are still certain situations, and if I am tired or if I'm particularly stressed, where things are heightened and my hyperacusis does still play me up. But it's much better than those first kind of 18 months after giving birth and before the CBT therapy. Things are much better, and hopefully they're improving all the time.
Amazing. I'm so glad to hear it. Thank you so much. And people can find you. You said obviously they want to have a look at your other work. It's indialawton.com, is that right?
That's right, yep. Or a Google search will come up with my website. And then I've got some other projects on there, some linking to birth trauma more specifically as well.
That's incredible. Thank you so much.
No, thank
Um,
you.
and thank you. Obviously, if people who are watching are having problems with any of the issues that we've raised today in our patient education program, please feel free to get in touch with Bashir International. Our website provides lots of interesting resources for patients, families, and health professionals. If you need help and support with birth trauma, there are many resources available, including Mind, who provide help on their website for those dealing with birth trauma, and the Birth Trauma Association. The main aim for Hashir International is to provide private consultations and clinics delivering specialist care for children and adults with misophonia, tinnitus, and hyperacusis anywhere in the world. We offer a premier therapy package which compromises targeted cognitive behavioral therapy for misophonia, tinnitus, and hyperacusis, combined with consultations with a multidisciplinary team of audiologists, psychologists, occupational therapists, and neuroscientists. Evaluated research on this package has shown very good results in helping patients to manage these symptoms and significantly improve their quality of life. Thank you so much for joining us this evening. Thank you.
Thank you. Bye bye.
Let me